Alright guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of what I call the Common Sense MD. Now, if you'll notice today, I'm surrounded by beautiful women, and so I'm kind of nervous about it a little bit. I'm not usually in such beauty, surrounded by such beauty, but I have the Marcum twins here, except for Jenny. Now I have to talk about her. But I have the Marcum twins here, and they're really not twins. They're really sisters-in-law. They're both pharmacists. We have Hannah and Catherine Marcum. Catherine is married to Colton, who's a pharmacist. Hannah's married to Brad Blackwell. So your last name's now Blackwell.
Yes.
I called you Hannah Marcum, which we
common. That's very common.
You grew up with our kids, and we always call you Hannah Marcum. So Hannah Blackwell, of course, her husband Brad works with us as our CFO.
He's the opening music on here.
Yeah, that's right. That's right. He is. He's the opening and closing music.
Yeah.
He's a great musician, and we may have Hannah sing a little bit at the very end of this podcast.
Yeah, that's exactly what I came to do.
But Marcum's Pharmacy has been around since the early 60s, probably before that, because my dad, who is a physician, had his office right across from the original Marcum's. Mm-hmm. And I know on my dad's prescriptions, it said to be filled at Marcum's Pharmacy. Yeah. I gave you some of them.
I was going to say, we have, I think, one's in a frame in the pharmacy.
Yeah, yes, it's pretty cool. It's really neat. But so they've been friends for many, many years. And now we have the new generation of Marcum's Pharmacy. Yeah. And if you notice, they've moved across the street in that gorgeous old building that looks brand new. Yes. That's an incredible building. As a matter of fact, in the 60s, my dad's office was right beside that, the doctor's building. And I mowed the yard of where you are right now.
Oh,
plus
still
the
did
next
that.
door. I may have to start doing that. But anyway, it's great to have you here because Marcum's is just a household name in Kingsport as far as pharmacies. And you've been doing compounding pharmacy, which is true to my heart because we use so many compounds. I was trying to explain this to somebody today, why you needed compounding pharmacies. And actually, it was somebody from the Tennessee Medical Association. I mean, it's not a well-known thing by a lot of people, even doctors a lot of doctors don't know about compounding pharmacies and why there's such a need for it. But how would you describe Marcum's Pharmacy? I know customer service is your number one thing that I see there. It's just so wonderful when you go in there, and it's just friendly. But how would you describe what would you say is so outstanding about your pharmacy over the decades that you've been there? Catherine, what would you say?
Well, we do all kinds of different things for our patients. We care about our patients. They're not just a number. They're a person to us. They're our patients. We've got grandparents, great-grandparents, children, grandchildren, and so we kind of follow the families. And so we just help in any stage of life, from medications from when they're little tiny things to helping patients when they get older with medication packaging, helping them get to where everything will come due on the same day, to just calling them and checking on them and making sure that things are okay with them. And we actually find ourselves on the phone a lot with them, just talking about just being a friend, because you don't realize how many times people are just lonely and they just want to talk.
Exactly right. I've always thought that pharmacists really should be able to prescribe medications personally. I really believe that. I know some pharmacists may not want to do it, but I think they should because actually they spend more time than the doctor does with them.
Mm-hmm.
Well, on that topic, I feel like that's something you can hit on it probably well that we're adding to the pharmacy these days. Just the ability to, so we've got, I can't think of the correct.
Point of care testing.
Thank you. Point of care. Yeah.
Yes.
Yeah.
Test to treat. So basically if you have, you're not feeling good, you want to be tested for strep or flu or COVID or a number of different other things, that you can come in or you can sit in your car, come out there and swab you. And
like you
then,
did me
yes,
back in COVID.
yes.
You also put an injection of immunoglobulins into my arm that
Mm-hmm.
night. I came down with COVID back 4 years ago, and it was awesome. Right out in my car.
Yeah.
It rolled down the window.
We did a lot
You
of that
poked
back in the
shot
day.
and it was awesome. I mean,
Y'all just
really
thought you
helped
felt
me.
better.
We spent a
over
lot
it.
of time in the parking lot in
Yes,
2020.
We did.
and it was cold that
Yeah.
night. I mean,
Yeah.
it was.
So we treated you. You knew that you had COVID. We treated you just the same as we can do with our when you have a test, you have a positive test for strep or flu or whatever, then we can treat too.
love it. I
So
love
it
it.
kind of saves you
I
from
love
having
it.
to go to the urgent care.
And you guys were really on board during COVID with the protocols
Yes.
that we used. I mean, you saved a lot of lives. You know, whether you know it or not, you really did.
We
And
look to you for advice on this.
We took a
Absolutely.
deep dive with
Yeah.
COVID, as you know.
Yeah.
But you know, I guarantee you that we kept a lot of people out of the hospital with it, and you guys are a big part of that. And you're to be commended for that. So you're family oriented, and you see people from little kids all the way up to 100 years old plus. Compounding pharmacy, you know, that's something not a lot of people know about. Tell us a little bit about compounding. Why you do compounds?
So I think that's kind of my area where I enjoy it. I started off, and I've had multiple different pharmacy jobs, but I just, through a friend, got a job at a compounding pharmacy and kind of fell in love with it. I fell in love with just what you're able to provide for people. I mean, of course.
That was one in Knoxville when you lived in Knoxville.
Yes,
Yeah,
and I
very
mean,
familiar.
I learned
Huge
so
one.
much there, but most of all, I just took away like, just really the patient care that you're providing is just something different than your typical retail setting, and I love it. So
And
I
you use medicines that you can't find
exactly,
normally.
yeah,
They're tailored to the patient.
absolutely.
That's what, like bioidentical hormones. We use so many of them. I guess those are the main ones that I learned about compounding pharmacy many years ago, and that's just changed people's lives.
Oh, yeah.
Oh, I think that's driven a passion in us as well. Me, Catherine, and Colton all just completed a course in like a hormone specialty course. I feel like,
Yeah.
I mean, it's something that so many people don't know about.
Yeah.
And
It's
And
a
if
shame
I
they
don't take
teach it.
mine, Colton doesn't want to be around me either. So.
I understand that. I can
Yeah.
understand that. I think women are more complex hormonally than men are.
that's fair.
Oh,
Taking all
definitely.
the courses, I mean, you've experienced it.
Very
it's just
good.
really harder to be a woman hormonally.
Yeah.
You know, I've always thought women are smarter than men. They live
Also.
longer. They're actually healthier than men by far. But when you hit the mid 40s and you start going into menopause, you know, you really need that hormone balance to feel like you did
yeah.
before.
Yeah.
Absolutely.
They're just
And women don't have to settle for that, oh, honey, you're getting old. You know, it's just part of
Yeah.
it. You're getting old. And we don't have to feel bad all the time. I mean, I know we're complex and it's tough to get everything balanced, but you can feel good in your 40s, 50s, 60s and above.
You
I
certainly
mean,
can.
really.
You certainly can. But if you don't
Yeah.
look at your hormones, you're not going to.
Well, everything goes downhill if your hormones
Everything.
aren't straight.
I mean,
Yeah.
it's just like nature saying to you, you're finished reproducing, start dying.
Right.
You get brittle.
I know. That's
I mean,
very
especially
true.
women with osteoporosis.
Oh,
and
yeah.
people just don't understand the benefits of these bioidentical hormones. They
Yeah.
are safe. They don't cause cancer. They do not cause heart disease. And they prevent them.
Yes.
You know, that huge new study they
Yes.
came out with a few months ago in PubMed. You can read about it.
Oh, yeah.
Hundreds of thousands of women from the age 65 to 85 that took hormones compared to women that didn't take
Mm-hmm.
hormones. Here's what happened. All-cause mortality was way less. Less heart attacks, less strokes, less deep vein thrombosis, less AFib, less osteoporosis, less hip fractures, less dementia.
cancer.
I mean, why wouldn't a woman want to take those?
Absolutely.
And not stop at age 65? That a lot of people say, well, yeah, take them up till 65 then quit. Why would you do that?
Yeah.
I hope I'm still going at 65.
I know. Well, I think that traditional medicine a lot of time prohibits that, and women don't feel like they can get. And it's not necessarily, they just don't know. They really just don't
Lack
know. And
of
I'm not.
knowledge.
Yeah, I'm not.
Yeah, there's misconceptions surrounding
Yeah,
it all
and
from providers as well.
right.
It is.
Right.
If doctors tend to be of the sort that if they don't know something about something, they poo-poo it. So if you do a deep dive, then you'll realize all the benefits. Unfortunately, these medicines have to be compounded, so you don't have a lot of advertising about them through the pharmaceutical companies.
Reps, yeah.
Nobody's going to come to your office.
Yeah, bringing you lunch, talking about it.
I know.
Well, and that's why we wanted to be certified, because we want to be able to talk to the physicians and give them resources and show them studies and new information that's come out. And we have a lot of physicians that are actually like, I'm not sure. What do you think? And we will make our recommendations.
They're eager to prescribe them, but they really need a foundation of where to start, and they're happy to communicate with
doctors.
us.
Are busy, and a lot of times they just don't have the time to learn it.
Oh yeah,
of course,
and
absolutely.
That's
and you want it quality stuff too. We work with a company, PCCA, out of Texas, and the quality of the bulk chemicals that you're getting there, the hormones, is just unmatched, really.
They're really trustworthy.
Yes, absolutely.
That's the gold standard for sure, PCCA.
And the studies behind it, they've got all the literature and everything that you could possibly need.
What other things do you like to compound besides hormones?
Well, we actually have started really trying to encourage wound care prescriptions. We've got a new product. It's called, it's new to us over the past year or so, but it's called Basagel. And it's a topical, would you call it emollient maybe?
Yeah.
Kind of an ointment that, so
it forms like an adhesive.
Yes.
There.
So what you do is if somebody has a big old nasty wound infection and they're not being, it's not working with like oral antibiotics, and you don't want to really do like an IV antibiotic. You want to try to do something that's topical right to the source there. You apply it to the wound, but what you do is you put like some type of antibiotic or antifungal or something, or a mix of those things, like a ceftriaxone.
Put it in the
cream? You'd pop open a little ceftriaxone vial, put it in the Basagel, mix it up, apply it to the wound, and you do that twice daily. And really, it washes off. So it's not like you have to scrub it, but it's right there. You're having a localized treatment right there. You have a little systemic absorption, but not like, not like
you get a shot of it.
Right. So
plus it won't mess up your gut microbiome. So.
Exactly. So, and it works really well. Laura actually had a pedicure gone wrong, and we'll try to put some pictures maybe in here about
seen
it.
Some of those. Yeah.
And her foot was just awful, and we ended up doing it. She failed with oral, what was she on, Bactrim, I believe, and then so we did this on the wound because we worried about her, getting worse. And it was remarkable.
We'll have to put some pictures.
Yeah, absolutely.
Pictures, but that's incredible. I've always thought topical applications somehow to me sounds much safer and more direct. I mean, why would you take an antibiotic that's going to do everything to your body, all over your body, and then mess your gut up when it's just infections right here?
Yeah.
If you could just locally put it up there.
Oh, yeah.
Sometimes even with sinus infections, like
we do it with nasal rinses as well. Yeah, same concept, but I mean, and sometimes like steroid nasal rinses. It's
how about nebulizers with nebulized aerosols for bronchitis and things like that?
Yeah, you can absolutely.
Can you add an antibiotic to that?
You could.
You can.
Absolutely. Yeah, like the nasonebulizer. You can definitely add some different things to that and just get it straight to the source there.
It sounds much safer to me than doing it the other way.
Oh yeah, it's great.
Directly
but again, it's like we try to talk about that more because a lot of people don't know about that and that product, and so it's amazing.
The average doctor doesn't know that.
How well it works. Yeah.
I think really people ought to trust and go to their pharmacist more. I think people do trust the pharmacist even more than a doctor, but it almost should be a point of stop before at times. I think. Especially when you can't get in the doctor. You don't want to go to an ER.
We're a resource that's always available. So
we are.
I mean, I do think that sometimes we are just a direct line of communication that they can always reach. So
I think so too.
Absolutely.
Even your dad, who's an
we're
ER
happy to do
doctor, he would tell you there's a lot of stuff that comes in there that does need to be there.
Yes. Yeah.
And thus the long wait times.
Oh, absolutely. I mean, I feel like we can absolutely direct people to where they need to be if it's not something that we can directly help them with.
Right. Right.
Plus, there's not enough primary care doctors out there.
No.
There's such a long wait. You cannot wait for some of this stuff.
I have found that over time I've become like a dermatologic expert just because we're a resource that they can walk right up to, and it's over time you see so many rashes and so many things that you become more educated on that than you ever realized
That's
you would be.
awesome, because a lot of doctors hate to see a rash come into the office. Because a lot of times they don't know what it is. But tell me about, speaking of rashes, we talk about Colton. I had Colton on here one day, and one of the nicest humans you'll ever meet. And you should see my podcast with him.
You're talking to his wife and his sister, so
wife, sister. I've never seen anybody that had that much allergies in my life. Man. I guarantee he should be in the record book sometimes because he was in our church growing up, and he had to leave multiple times for anaphylaxis. How many times has he been in anaphylaxis?
It's hard telling. I don't know. I've had to shoot him many times with an EpiPen.
I mean, that is
I wasn't even mad at him when I got to shoot him.
It's become normalized.
That is as scary as anything there is. I mean, I was in anaphylaxis one time and spent the night in the hospital because of it. Got the wrong dose of an allergy shot that they had given me back when you could give them at home, and it would have killed me if I hadn't rushed myself to the ER.
Wow.
But in any event, the reason I'm mentioning Colton is because not only because he's Marcum's, but because of the LDN. And I think that's probably what we talked about in our podcast. But I mean, not many people know about low-dose naltrexone and the many benefits for autoimmune diseases and all kinds of stuff. But talk to me, since you've seen it and it's available at your pharmacy.
Oh yeah, absolutely.
I mean, tell about what all it can do.
Well, I know, of course, Colton, it really helps. Of course, his allergies are crazy, and inflammation and itching, and he's got really bad eczema and just, and with him too, so you can see his skin just ease up and just get better over time. Of course, it's a bit of a slow process. Yeah. But once you get it and you're maintained, you can tell if he has missed his dose for a week, buddy, it comes back with a vengeance.
I saw him before he started it, and then several months later, and it was pretty incredible what happened with his rash.
Oh, it's amazing. And what a wonderful medicine to start with instead of having to go to some of the other harsher,
we've actually
injectables.
Gotten a lot of people off of Humira or methotrexate that had rheumatoid arthritis, they had lupus, and they're controlled just on LDN, which is an inexpensive, very safe medication. I think the only side effect I've ever seen from it is you may dream more. You usually take it at night. It actually helps you sleep. Both my type 1 diabetic kids use it, and it's really helped that autoimmune disease. But it's pretty phenomenal. Isn't it
really is. Now, I will tell you, sometimes people have that, one of those, you call it a paradoxical effect with it, where it actually keeps them up at night.
Really?
So if that happens, just take it in the morning.
Take it in the morning.
There you go.
I tell people if they have vivid dreams with it and they just don't like that, take it in the morning. It doesn't make you sleepy. Kind of like melatonin. Melatonin, if you took it during the day, it does not make you sleepy. It's only if you're in total darkness. I have one guy that takes 150 milligrams a day of melatonin.
Wow.
You're kidding.
He takes it in the morning. Yeah. He takes it for other reasons of sleep. Of course, he doesn't take it for sleep, but it has a lot of other beneficial effects that are pretty incredible. But low-dose naltrexone is a great little product. Another one that I always talk about is methylene blue. I don't know how
we
much
just recently started compounding it in capsule form.
Yes.
Along with vitamin C. Put vitamin C in there because it really enhances the absorption. And so I like methylene blue. I take it every day. But I think it gives you focus. I think it gives you energy. I think it helps you breathe better. When you think about it, it's been around for 150 50 years
Yeah.
probably. I
Yeah,
mean,
a
it
long
works
time.
as an antibiotic,
It's
an
used in the ER,
antiviral, antifungal. They use it in the ER. You say you
And-
come in
and
for
different doses.
Yeah, and more concentrated doses in the vein for carbon monoxide poisoning.
Yeah.
I'm sure your dad used it a few times.
Yeah.
Sure.
Yeah.
But it'll save your life. But if you
Oh,
have
yeah.
cyanide poisoning or carbon monoxide poisoning, so it's and they're also making in creams for face. I don't know if you all are compounding that yet or not.
Not
but
yet, but that's
it's supposed to be
interesting.
like as good as Retin-A without the redness and some of the
Wow.
desquamation you get with Retin-A. You need
Yeah,
to look into
certainly-
that
certainly
one.
We,
You
we,
like
probably
we
that.
absolutely
can
will.
make a
Yeah, because
good.
we do a lot
Yeah.
of Retin-A products.
Yes,
Yeah, I mean,
absolutely.
Retin-A is a
That
good
would be
product, but a
great.
lot of people cannot tolerate.
Right,
I'm one
right.
of them.
Yeah.
If I use a tiny dose, I'll look like a lobster the
Oh
next
yeah,
day.
yeah.
You know.
We can also put a little CoQ10 in there for your cellular health. Yeah, add a little bit of
Yeah.
that in there. So
Makes
that's
sense.
good. Yeah, yeah.
One thing I was thinking about Colton, just the change that he's done with the gut health.
Oh,
Yeah, that's-
I mean,
yeah.
somebody like him and a lot of people that we end up seeing are complex. And those are the patients that I love to see. And those are the patients that I like to send to guys like you because you can help them with outside the box stuff.
Oh yeah, absolutely.
Because sometimes
Well, you love that because
Yeah.
you get to help somebody.
Yeah.
You know, you really do. That they're searching for something, they can't find it, and if you
Yeah.
can help them have a better life, it's just wonderful.
and a lot of times they're labeled as there's nothing wrong, there's nothing to help you with.
Right.
We'll put you on the steroids. We'll maybe
Yep.
try.
I think the highest dose of LDN we do had seen like 10 specialists before they got to you. And it has been some post-COVID issues that they were having that was affecting their ability to walk. And it is the first thing that's helped them.
That
Wow,
is
that's
amazing.
Yeah, long COVID. That's a great
That's
another
it.
subject for LDN.
Yeah.
And some of the stuff you guys do. Methylene blue works great for it, but LDN's been a lifesaver for long hauler COVID, which may be 1 out of 4 people that got
Yeah.
a good case of it.
Shocking amount.
I mean, if you went to Stanford Long COVID Clinic, Stanford University, you know what they're using? LDN
Yeah.
now.
It seems to be one of the best things available for some of these undefinable or,
Yeah,
hard to diagnose.
Yeah,
Absolutely.
It just kind of shocked me that they were using it as the first line because it's definitely outside the box.
Yeah, it makes me
But
happy to hear,
It makes
actually.
you very
Yeah.
happy to hear it. We've
Yeah.
been using LDN for years and years for many
Yeah.
things,
Yeah.
but I think long COVID is something that it really messes your immune system up.
Absolutely.
Autoimmune diseases, Hashimoto's,
Seem to be
I think-
on the rise.
and we're getting more and more of that. We're seeing more Parkinson's. We're seeing more cancers. We're seeing more of a lot of things now that we didn't see just a few years ago. I
Yeah.
mean, medicine changes, and if you don't keep up with it and kind of think outside the box, because by the time something has been through rigorous FDA approval, it takes years and years.
absolutely.
And then
Yeah.
the prices are ridiculous.
Oh, man.
That's the last thing we're going to talk about here is pricing. I'm glad I thought about that
Fun
because
subject.
we're going to do a podcast on the economics of drug prices.
Oh, man.
Oh, that's
I mean-
a whole, that needs its own, series.
We'll have a series on this because this is crazy, but I see this every day. Example, I had a guy that drove up from Knoxville to see me here in Kingsport, and he has a pretty good case of narcolepsy. So I prescribed generic modafinil, and which is a great medicine for that. And now it's generic; it's affordable. So he drives all the way back to Knoxville and goes to CVS Pharmacy. I don't mean to mention names, but
You're in good company on that one.
You can look at my eyes when I say that. But anyway, so he calls me back that afternoon. He says, Dr. Rogers, I cannot take this medicine. They're going to charge me $750 a month
Yeah.
for that modafinil. And I said, put the pharmacist on. So I said, are you using generic modafinil and it's $750? And of course, he had no control. He says, yeah, that's what we charge
yeah.
for it. So I said, put the patient back on. Then in the meantime, I had my nurse look it up on GoodRx. $35
Yeah.
was the cost at somewhere. But
Yeah.
why is that? I mean, what's the rip-off with that? Somebody's getting
I
ripped
wish I
off.
wish I had a better explanation for it. I mean, I know that in my experience, so I started off in the chain stores, and I will say, in the pharmacist defense, they have no resources there. They have, I mean, in those settings, they don't have access to anything except for the number it spits back at them, and so then going to independent pharmacies post my, experience at one of the chain stores, I was in shock. Like, could not believe what we had been charging people based off of what the real numbers are. But
It's phenomenal. A lot of times I find that I tell people this. I say, don't use your insurance. Just ask them the cash price.
Oh, yeah.
we do that often. I mean, we always, alert patients when that's a better option.
Yeah.
And a lot of times it's cheaper than if they use their insurance.
Absolutely.
That does not make any sense at all
It's
to me.
crazy.
It
It's
doesn't.
crazy.
It may have to do
There's no,
something called the PBMs.
Yeah.
Again, you're going to need a whole series
We're
on that.
laughing. The word PBMs
that you just
is a dirty word to me.
Yeah.
It started
you
out
just
with
raised
maybe,
the hair.
Yeah.
I know.
Hackles on the back.
Maybe they started out with a noble cause, but
Yeah.
these are the guys in coat and ties on Wall Street negotiating prices between pharmaceutical companies and insurance companies, and they are eating up all the profit themselves. And the rebates, they disguise it in
It's
very
convoluted.
ways that you're not going to understand it. Your doctor's not going to understand it. Your pharmacist may, but it's a ripoff of major proportions. I've talked to our congressman about
Oh,
it.
yeah.
and
Raising
they
healthcare costs.
They have to
just-
put those out of business.
I'm telling you, they need to. I think they're working on
Yeah.
some.
They assure me they are. When I
Yeah.
go to Washington
Yeah.
and talk to
They.
them, but
They.
it's
just needs to
definitely
be
almost
addressed.
borderline criminal activity, in my opinion.
Well.
It's legal criminal activity of rip off the American public, I think. So when you go to a pharmacy, if you have a drug you need filled, ask, I want to pay cash for it. What's the cash price?
Yeah.
Absolutely.
And a lot of times it'll beat the price of your insurance company.
Yeah.
And I do think going to an independent
Yeah, that's what I was
pharmacy
gonna say.
is the key to that because,
Yeah.
again, not to hold it against the pharmacist at chains, but they truly don't have access to
Yeah.
another source that'll give them a better price. And
Yeah.
I mean, sometimes what they're spitting back at you is absurd.
Don't you just
Yeah.
enjoy your life as an independent pharmacy compared to working for one of the big box chains? I can't imagine it. For me, not being in corporate medicine, really, and having my own practice where I do the things I think need to be done, I don't have to worry about coding or, being on a computer all day. It's so much more freedom. There's no way at my age I'd be practicing medicine if I had to do that anymore. So you are very fortunate.
The hoops you have to jump through in those settings just to provide even the most minimal care, is just really, it was so disheartening. Just not my favorite time.
You're almost
in
like a
my
rat on
career.
a treadmill in a way, aren't you?
Amen. There's a conveyor belt back there of things that I'm supposed to be checking as fast as I possibly can. I mean,
Yeah.
it's a
And this way you get to talk to your patients, and it's also a family business. My business has turned into a family business, just like your guys.
yeah,
Mm-hmm.
absolutely.
And it's been going for so many years that there's a certain trust and legacy in that pharmacy called Marcum's Pharmacy. And it's wonderful. And you ladies, doctors are just so good at it. And I want to thank you so much for
We
coming
appreciate
on here.
Thanks
Go
for
visit
having
Marcum's Pharmacy. You get compounding there that's the utmost quality. It's just fun to watch you guys have success and enjoy your families and your patients and your friends. Don't you feel like when somebody comes into your office that it's just like a friend you're helping out?
Absolutely.
It's not,
Absolutely.
It's not just a customer.
No.
It's really a friend.
Yes. Absolutely.
And you're helping somebody out. Fortunately, we're in a profession where we can actually work and help people. That's what I thank God every day that I'm
Yes.
able to do that. I'm blessed to be
Yes.
able to, in my job that I make a living at, actually help people directly.
Oh, absolutely.
And that's certainly just, the cream on top of the.
Yeah, it's absolutely a blessing to be able to help people.
Yeah, well, you ladies are really incredible. Thank you so much for coming in here. You're not only trusted colleagues, your friends. So
Yeah.
thanks for coming in
Thank you, Tom.
and
Thank
agreeing to this.
you. Thank you so much.
Okay, Marcum's Pharmacy, thank you. We'll see you next week.